Hey y'all, and welcome back to my channel. Hi, if you're new here, my name is Lauren and I am a junior nursing major at Troy University. I just finished up my second semester of nursing school and I will be proceeding on to third semester come January, and I'm so excited. But I thought that the best way to accurately give tips and suggestions for second semester would be to ask my classmates who just went through it, and I'll also be giving some of my advice and things that worked for me. So that is exactly what I'm going to be doing today. So stay tuned and let's get started. I asked my classmates through a Google form. There were 8 different questions on there. So I asked about like how many hours a day they studied, any extra things that they wanted to say, which class they thought was the easiest, the most difficult, and in between, clinical like tips and suggestions, and even some check-off tips. So that is what this video will entail, and I hope that I can give you the most information possible so that you're prepared as you can be going into second semester. But I am not going to take away from the fact that it is hard and you do have to put work in, and if it wasn't possible, we wouldn't have made it through. I have 35 responses on this Google form, so I have a lot of input, so I'm going to try to condense it down to what the majority said, and then if there's something that I think is really cool that sticks out, I'll also mention that as well. So my first question was, how many hours a day do you suggest to study? So I know, me personally, I don't always have to study as much as other people do. I will definitely spend the whole day before the exam and the hours leading up to the exam studying, and that definitely took a hit this year. I'm used to doing that and being able to pull out A's, maybe a B, but this semester I did make my first C, and that is totally okay. I know what I have done wrong and what I want to do better for the next semester, but the average answer for my classmates is about 3 or 4 hours. So I had a lot of people say that they study 2 or 3 hours, and a lot of people say that they study 4 or 5 hours. Some people say they will study more on test weeks, and some say that they only study an hour or so a day, maybe 2 hours a day, and that way whenever an exam comes, they're ready. I know I did not study every single day, but that's just me personally. Some people said it depends on where your headspace is. If you're not in the mood to study, it's not going to be productive, so don't waste your time. I also had somebody say that they only study 5 days out of the week, so that 2 of the days they can take a mental break so that they're not overwhelming themselves. The ultimate answer to that question is going to be whenever there is an exam, and however you prep for your exam, that is going to be the best way that you can study. You're going to give more hours when you have an exam versus when you don't. But I definitely say any of the like small assignments that you have that are going to be due later on in the semester, I say go ahead and get this done at the beginning of the semester so that you don't have to worry about it when you have 2 exams in a week and you're also having to do a virtual simulation or something like that. You can just go ahead and have that done, and you don't have to worry about that, because about the first week and a half, it's kind of slow. You're getting into things, and then after that, everything starts hitting you really fast. So my biggest piece of advice, go ahead and get those done, and then that way you can devote your time to studying and not having to do other things when the time comes. Another thing is for psych and adult health, you're going to have course point quizzes due just about every week. I think it's every week. So all of those are open at the beginning of the semester. I definitely think you should go ahead and get those done. Psych closes Mondays at 9 a.m. before you have class. So those need to be done each week. And then adult health, they're all open, and then you can go back and use them to practice throughout the semester. So go ahead and get those done as early as you can. It does help you with studying purposes, but sometimes it is just more of a hassle than it is helpful. So go ahead and get those done. And if you want to go back and use those as study materials, you can. Okay, so the next question that I asked my classmates were, what tips do you have for a future second semester student? And the responses were all along the same line. Basically, study, don't procrastinate, learn how to manage your time, learn what works best for you. But I do want to read one that I think is really a good just bottom line for second semester, and it's so important. So it says, don't go into second semester so worried and afraid of it being extremely hard. It is tough, but always remember your why and don't let yourself get discouraged. Take one day at a time and try to decide what type of studying helps you most. Having a planner is also super helpful. This way you can go ahead and have everything laid out over the course of the semester and you will not miss assignments, tests, or clinical days. Another thing is asking older semesters what they did that made them successful. Obviously, they've already passed it, so they did something that got them to that point. Ask them how you should study, what you should do. For adult health, studying the ATI book was really big for us. For psych, we were able to go in and look at the book and look at like different care plans and stuff like that. Also, going to test reviews, they're so important. I know somebody said that they got points back on an exam that they went and reviewed because they caught that the answer was wrong. I know I got a point back on an exam because it counted it wrong in the system, but it was actually correct. So go to those test reviews, especially psych, because not many people went to psych test reviews, and they're so important to go to because I know that that's the class that most people would get points back if they caught a mistake. Also, doing your drug maps, your concept maps for each of your drugs for pharmacology, doing them prior to class. Then when you go in there, all you have to do is fill in any extra information, and you're not sitting there trying to write all of your information while the teacher is talking. So you can just kind of listen to what she's saying. If she says something important, you can write that down, because trying to do it at the same time, you're going to miss other important information. I know that I did that most of the time. There were some times that I didn't have those done going in, but most of the time I did, and I definitely think it was more beneficial for me to be able to write that in than when I was trying to write the drug map for the first time and listen to what she had to say. Okay, one of the last tips was don't forget to take time for yourself. Second semester can be really stressful. Life can be really stressful. I know that nursing school is not the only thing going on in someone's life, and it's really important that you take time for yourself. Don't pity yourself over that break, but make sure that you go out, you have fun. Like you need to have a life outside of nursing school. It's not healthy for you to sit there and let nursing school consume your life. It can be consuming, and it's really important that you stop, breathe, and take a moment to be a college student, because you are. I'm not saying go out and party every Friday night, but I am saying that it's good to sit back and relax and take a little bit of time for yourself, because that's so important. So my next 3 questions are, which class did you think was the most difficult, the least difficult, and which class was in between? So I'm going to rank it from the hardest to the easiest, as my classmates have said. So my classmates said that adult health was the most difficult class in second semester, and then pharmacology was the second most difficult, and psych was the least difficult for second semester. I probably would have put pharm, then adult health, then psych, but you know, everybody is different. Adult health and psych adult health and pharm were very close on which one was which. And so you have to spend your most time studying there. You've got clinical for adult health, which has a lot of paperwork. So I think that also plays in with it. You have checkoffs. So it's not necessarily just the lecture. There's more that goes into it than just the lecture part of it. Okay, next up is adult health practicum. I asked for tips and suggestions that they had for y'all. And the first tip is, if you are really sensitive to smells, put Vicks Vapor Rub in your nose, and it will help kind of block out smells. There are some pretty nasty smells out there, so that helps. Another tip was practice your skills on anything you can find. When we were doing like IV, people would use the tube of a Foley catheter, or they were doing injections in an orange or a hot dog, I think. So stuff like that, just being able to practice. They suggested videoing the teachers when they perform the skill, and then going back home and watching that, then videotaping yourself, finding what you're not doing. Be able to perform your skill well, because they're more worried about, can you do the skill, not necessarily can you recite the words. You need to be able to say what you're doing, because if you can say what you're doing while you're doing it, then like you know why, like the reason why you're doing it. But it's not necessarily a big deal if you forget a word, unless it's a bold. Like if you forget something, it's not a big deal if they see that you're doing it. So another tip was being confident and eager. So going into clinical, jumping at every skill that you could possibly do is super important, because you're never going to get that experience unless you actually get your hands on it. Be compassionate and be able to watch nurses if you're not comfortable doing it, but like definitely try to perform any skill that you can. Be really hands-on in clinical. That's exactly what it's for. You're supposed to be getting this experience so that one day you can perform these on your own. And a lot of times the facilities are wanting these students to perform this because they know that one day we're going to be replacing them. So just doing whatever you can. Ask questions if you're confused about something, even if you have to email the teacher about it. I know I emailed my teachers multiple times this semester asking questions because I was kind of confused or just curious, but it also helped me get a deeper understanding of the situation. Like schizophrenia is just kind of mind-boggling to me. So I know I emailed my psych teacher asking about that, and I didn't realize that the words that they hear are just derogatory and so hateful, and I feel like that would just put me in such a negative mindset. So I know I asked different questions about that, and it really helped me understand what they're going through on a deeper level, because I've never experienced that. And so just being able to question your teachers, understand any topic, ask to do skills. Like I know I told my nurse, I was like, hey, like if you have any skills that I can do, please let me know. I would really like to. I can tell you if I can or can't do it. Or like if you want me to watch a skill, I'd love to do that, because it's super important to be able to get all of that experience, like just as a student, so that one day you're going to be able to perform that as well. Okay, so psych, clinicals, and practicum. One of the first tips is go ahead and get your VSIMs and your Prep U quizzes and any of the other assignments done as early as possible before you get hit with exams. That's what I said earlier, but someone else said it, so I did want to include that again because I can't stress that enough. I know there were times where I didn't have to sit down and do something where my friends were, they're like, oh my gosh, I've got a VSIM I've got to do. Well, I finished all mine in August, so I didn't have anything to worry about. Another thing is, there is such a stigma around mental health and thinking that people with mental illness are crazy. And the biggest advice that I've gotten is keep an open mind, do not judge, go in, pay attention, observe them, but they're not crazy. And it's really hard to go in with what you've heard from other people and what you've like seen and the media has made it out to be. But go in and really get to know these people and try to understand the process that their brain is going through, because there is an alteration in something and it's not necessarily their fault. So going in with an open mind, really trying to understand, asking questions, going through the paperwork and trying to be thorough with everything that you do. Don't let rumors scare you. Be empathetic towards your patients and just try to show that you're not there to judge them, but to learn. Okay, so the last thing that I put on there was anything else that you have to say about any class. And a lot of people said just making sure that you get ahead early and stay ahead. I had some people who really put their feelings out there saying that second semester was a doozy, let's say it like that. But it really was. Try to do your assignments early so they don't pile up. Second semester is busy. Everyone is saying second semester is busy, and it really is. But the best thing that you can do is stay organized and stay on top of things, and don't let yourself get overwhelmed. That's easier said than done. I know I got overwhelmed a couple of times, but just try to do your best to set yourself up so that you won't be overwhelmed as much as if you didn't set yourself up like that. I'm super excited for third semester, and I wish you the best of luck in second semester. I hope some of this helped you, and I plan to do this after each semester so that anybody can look at it and kind of understand what we just went through. It's not just me with this stuff. I literally went through this Google form, read all of the responses, And I just wanted to provide y'all with the most information possible so that y'all can be successful. You're going to find what works for you, even if it wasn't what worked for us. And I am so incredibly proud of you, and I can't wait to watch you become a nurse. Thanks for watching, and I'll see y'all next time.